definitely. All right. Sorry, I sound like Kermit the Frog, but I've been talking a lot to people this week, so my throat is shot. In accordance with Executive Order N-08-21, the Humboldt County Board of Supervisors meetings will be held virtually until further notice. You can make public comment by on the call-in conference line. You can please call. Sorry, I'm doing this. I know some people cannot see this, so I'm trying to read it all. Call in 253-215-8782. Meeting ID is 850-1740-0582. And hopefully that's all you need. Tracy, do they need a passcode?
No, they do not.
Okay, thank you very much. So at this point, let's start with the roll call. Tracy?
Thank you. And thank you for your patience. We had 2 computers crash. We apologize for the long delay. Supervisor Bohn, are you available? Okay. Supervisor Bushnell?
Yes.
Supervisor Madrone?
Can you hear me?
Oh, there's Rex. Yes, thank you.
Yep, I want to get in quick before Steve kicked me out again.
This is a weird position to be in. Any rate, I'm here, yes.
Okay, Supervisor Bass?
Yes.
And Supervisor Wilson?
He's going to be absent.
Okay, great. Thank you.
All right, so we're going to move on to the salute to the flag. And we are doing adjustments, so please start. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. There you go. That was interesting. All right, so do we have any modifications to the agenda? I've not been told of any.
No, there are no modifications to the agenda.
All right, thank you. I will move on to the consent calendar. We do have one item, and that is the ratification of the requirement to return to indoor masking in county facilities. So do we have a motion on the consent calendar?
So move.
And is there a second?
Second.
All right, thank you. Seconded by Supervisor Bohn. So Tracy, I cannot see hands up. So are there hands out from the public who would like to comment on this item?
Yes, Chair Bass. With the number ending in 5288, please press star 6 to unmute yourself, please.
And you will have,
Kent Sawatsky, can you hear me?
Yes, Kent,
Yes.
you have 3 minutes.
Tracy, I highly recommend, please hold on a second to start my time. Highly recommend you comment phone number and your meeting ID. All morning long, I was precluded from getting on without a password. I couldn't do so until Virginia gave it to me. And so I most likely will be the only one calling in on this. You do have a problem with having a meeting where Kent Sawatsky is the only participant, although I'd be honored. So I highly recommend you check into that. And now I'd like to start my 3 minutes, if that's possible, Virginia.
all right. Go that this time.
So on your consent item regarding the masking there, this already was put into effect. My understanding is July 29th. It states in here, is with all this in mind that universal masking in indoor settings is now recommended, again, by the Centers for Disease Control, CDC, California Department of Public Health, CDPH, and recently ordered by the Humboldt County Public Health Officer. So apparently we're going well beyond what is recommended, and we are going ordered. That's kind of like could or shall. And so you do have a major difference there. So the public does want to know justification for this. Not that I don't support the concept. I just don't support necessarily a process. And of course, I was informed earlier in the day that as long as you go more stringent than these organizations do, but I question why you're going more stringent than that. That's just a procedural question on that thing. Let's see, I did have a few other notes here. I do take my time and go over this stuff, obviously. I hope you guys are also. So those were the main question I happened to have on the masking. There were a few other questions, and I don't know whether it's on this one or the other one relevant to that, but are you also enabling your employees to work at home now? In other words, when we come in there, we are required to wear that even though it's just a recommendation somewhere. And I will wear mine no matter what. I want to stay alive. I've been vaccinated. I wear my passport around my neck. But I do have a question, regarding why you are going with a shall rather than a should, could, or would. So that's my main concern on that one. And my biggest concern is I don't think you can have this meeting without having people easily being able to participate, which the circumstantial evidence is they can't. And I was trying to use my other phone to see if currently I have to have the password. You may wish to try that before you continue this meeting. Thank you for my opportunity to speak.
All right. Thank you, Kent. I'll go back to, is anyone else there, Tracy? Sorry, should ask first.
I do not see anybody else at this time.
Okay, so we'll go back to the board. I guess my question would be for either Karen Clower or maybe Jefferson. Is this actually something that's actually going to be discussed in the next item, basically?
Is the masking going to be discussed or
Or
the
the-
opening?
I guess his question was kind of a little bigger, but in this instance, I think what he wants to find out is, did what we did was legal or right and appropriate, and why we went to the must. So that is the question I got from what I heard, and I'm wondering who would be the best to answer that,
I'll defer that to Jefferson. Thank you.
or Dr. Hoffman, whoever, I guess.
Chair, I guess regarding the consent item, everything that is part of your next item about the masking order applies equally to county employees. That's the same justification. And actually the county health order is sort of superseded the order that's being ratified, but that can be discussed as part of the next item.
Okay, I thought they were very similar. So unless anyone feels differently about that, that's how we'll proceed. Are there any supervisors that wish to comment on this before we vote? And just speak up because I can't see you all at one time. Nobody? Tracy, I don't see any. So we have a motion on the floor in a second. So let's maybe we have a roll call vote.
Yes. Supervisor Bass.
Yes.
Supervisor Madrone.
Yes.
Supervisor Bushnell.
Yes.
Supervisor Bohn.
Yes.
Passes 4-0. Thank you.
Thank you, Tracy. So we will move on to this next item. Matters initiated by board members, and this is coming from me, but I think it's basically could have come from any one of us. And we know we will be going to go back into regular board meetings next week, and we know that we do not want to do that. So we need to have that discussion and make an official action on what we'd like to do. But I would like to ask, I guess, Dr. Hoffman or anyone from the team, if they'd be able to provide kind of an update of where we are and explain why this is so important.
Thank you, Chair Bass. Thank you, everyone, for being here today. Briefly, I'll just say, I think that things are changing very rapidly in our county. The Delta variant of the coronavirus has shown itself to be much more contagious, as we've discussed previously. And I think when we couple that with what we're seeing right now as a moderate vaccination rate and a fair amount of openness and not very much masking going on in the community, we're seeing very widespread right now. The case rates have more than quadrupled in the last couple of weeks. We are seeing the hospitals filling up to a degree which they have not previously. And so we're all very concerned. So as you mentioned, we did take the step earlier this week to announce that we'll be instating the mask mandate again. That goes into effect tomorrow morning, 12:01 a.m. tomorrow, Saturday, August 7th. And we are hopeful that that mask mandate, coupled with people reconsidering gatherings, will help drive down the case rates over the coming weeks. We hope to not have to take any further steps to control this current surge of cases in Humboldt County. So we'll be monitoring them for now. Happy to hear from the rest of the team if you have any other things to add on to that. I'm happy to answer any questions.
All right, and Tracy, since I can't really see everyone clearly, if someone has a hand up. I do see Supervisor Bushnell.
Hi, thank you through the chair. Dr. Hoffman, I've had lots of questions why we initiated the mandate for masks, but are waiting till Saturday. Can you clarify, please?
Yeah, so typically with a order of this magnitude, we want to give people time to prepare. We are asking, businesses to get the signage together again, to have masks on hand in case people show up without a mask. It's been many, many weeks since we've allowed people who are fully vaccinated to go throughout the public without a mask. So it's a big change. Even we have been recommending it for several weeks. The mandate is a big change, so we wanted to give people time to get ready for that.
All right. All right, thank you. So any other supervisors? I don't see any, but I could be missing it.
Yeah, sure. This is Steve Madrone.
Steve.
Good to see everybody. Yeah, it's been a kind of a steep climb here of cases over the last couple of weeks, and I appreciate this order coming out. I think it's the right thing to do. I am getting calls from employees who are concerned that, everything got shut down. They were told if they got vaccinated, they'd be able to go unmasked and move forward. Now we're remasking, and it's nobody's fault. I mean, we're learning new things every day. Everybody's doing their best to try and figure out how to keep our community safe. And unfortunately, that means some steps backwards here. But I know that there are some people who just, for whatever medical reasons, they cannot mask. And you couple that with the fact that the unemployment benefits run out on September 6th. Now, maybe the federal government will do something new, but I know there are a lot of people I'm getting calls from that are very anxious about the fact that they cannot wear a mask, so they can't go into work, and they don't have a personal computer or space at home to work, so they can't work from home, and unemployment benefits are going to run out in 4 weeks. For everybody, as I understand it, they run out on September 6th. There is no extension past that at this time. So there's a lot of concerns about all that, and I'm just wondering if, it's really going to be a department by a department situation, but it might be that we might need to make further accommodations, buy more laptops to keep people working from home if they can't mask and they can't come in. And these are typically vaccinated people that are saying they just simply can't mask. So I'm just, that's one of the feedback pieces I'm getting. Maybe it's a little bit off topic, but we'll see what Jefferson has to say here.
Yeah, Jefferson did have his hand up, so.
Thank you, Chair. I just want to remind the board, this is really about resuming your board meetings. And obviously on Tuesday, we'll have the full COVID discussion where we could get into some of these other areas.
Perfect. Thank you, Council.
Yeah, I think thanks for reminding us, Jefferson. because today's a pretty simple one. Any other supervisors have a comment or further question?
What? Through the chair,
Yes.
can you hear me?
Yes, Rex.
Hello? Yeah. Well, I think as everybody becomes, it's amazing, with the internet and everything else, everybody's a lawyer and knows more than everybody else. But I looked up the definition of a public health officer, and lo and behold, it's to protect the public health of the area which they are hired to serve. And I think that's why our public health officer has put this mandate, because our hospitals are pushed to the edge. The management of all the hospitals are literally freaking out. And in his decision, we, like it or not, we have chosen, and I'm not saying either way, I'm just saying I appreciate him stepping forward, because I don't think he's invested heavily in any mask corporations or anything else. I think he's doing what we're paying him to do, is look out for the public health of Humboldt County. And I can attest, I appreciate that. And I think it's in the right direction. And the first thing he had told me when we had talked was, I'm doing this so we don't have to shut everybody down. People can still open their wallet even if they have a mask on. They can still go to a store. I mean, there's still a lot of avenues we can do. We just need to be careful. And, not to get off topic, get the damn vaccine. But I think that's where we need to go. So I just want that was brought up, and I never knew we reacted to public comment, but I did want to react to that.
And see, I'm going to try to make mine kind of in the vein of this one about the meetings next week, since I brought it here. I can say Supervisor Bohn hit a lot of the really important areas. You'd be risking our staff.
I can't make the in-meeting person next week, by the way. I've got.
Yeah, we know. Anyway, what I was saying was, it's the responsible thing to do. I've had a relative in the hospital for 9 days, and I was hearing the stories of just how bad it was for everybody, and there's no beds. And so, yes, I'd prefer we don't have in-person meetings quite yet. We go back to full Zoom meetings. But I'd like to remind people that we didn't need to be this way right now. We didn't need to be at this point where we have to start doing this to people and telling people what to do. There's members of the community who, let's just say, self-attestation was a failure. And we couldn't have board meetings in here and actually expect to keep our staff safe or anyone else there. And I'm mad, okay? I don't get mad, and I'm mad right now, not at us, about others who think this is a joke. So I completely support just going back to Zoom. And that's what this one item's about. So we can make a simple motion and then have this bigger conversation Tuesday. And my voice may give out before then anyway.
I would move the recommendation.
Thank you. We have a motion. Can I have a second?
I kind of wanted to say something. That's why my hand's up.
Oh, I can't see your hand, but will you take it as a second too? Or okay. I just want to get a second to the motion, and then I'd like to do discussion.
Yeah, I'll second the motion.
Okay, thank you. And the floor is yours.
Well, I just wanted to respond to what you said with your little thing there, that even, people that are vaccinated, obviously, as we are aware, are getting the COVID-19, are getting the virus. And so why you said self-attestation wasn't working, I think with the virus being, with people that with the vaccine getting it, I don't know that we can make, I'm not willing to make that blanket statement. So what I'm willing to say is that breakthrough is happening even with vaccinated people. And so with that, brings a different amount of problems, but I am willing to second the motion to keep our community safe.
And I appreciate that. We're all allowed to have our own personal feelings about it. And I've just known some who didn't, and it made me really unhappy. And I just hope people recognize that. Hopefully we'll find out more next week. I think those of us who are vaccinated are less likely to end up seriously ill if we do get a breakthrough. And I mean, that's the important thing to me. And I worry for my children, my grandchildren, quite frankly. So this is a personal topic for everybody, and I understand that. So we can have a much deeper talk about it next week. But at this moment, we do have a motion and we have a second to resume Zoom. And so at this time, I will go to public comment, and I suspect there is one hand up.
Yes, Chair Bass, caller 7454.
Welcome, Kent.
And Virginia, you can hear me, Virginia?
Yes.
Last thing I want to do is throw a monkey wrench in this, but I did do a test, and it's still required to have a passcode. So if anybody else wants to comment and you're not able to do so, I don't think it's even been read into the record. It was provided to me on a screenshot by Virginia. Thank you so much earlier. It's 671527. That's 671527. Correct me if I've misread that, Virginia. Hopefully that's right. And I still think you possibly should ask county council. No, I'm not even going to go there. I want this meeting and I want the decision. So I'm going to leave this one alone. In the future, if you do not have a passcode and you're having a meeting, it's not displayed on the agenda, which I checked again, it wasn't, nor on channel 10. Hopefully you'll have a policy of some way of dealing with that so the public can have a do-over or something of that nature. I do wish to strongly suggest that we stay with Zoom. I totally concur. You know, this whole topic here, and I don't want to use the term angry. I totally understand, but I'm going to say disappointed. I'm very disappointed of the lack of intelligence and lack of consideration that people are showing for their fellow human beings. And by not getting Madrone and not wearing a mask instantly back out there. And I'm very disappointed. Mother Nature has interesting things, you know, and I strongly support going to this. Should some people's crystal ball come through, and it's definitely going to be a policy we may be stuck with a long time. We may be stuck with Spanish flu 2.0 with a 95% fatality rate. I sure hope not. If that is the case, and everybody hopefully will follow the policies you have, I strongly support you going next step further, maybe next meeting, allowing people to work at home, like you said, and making sure that's put in place. And I think we should all take this extremely seriously. And so those are my recommendations on this particular topic. I did have questions. Originally, when you folks went and were having the first COVID meetings there when it was here, I was sitting in the chamber and you had a air circulation system that was a circulating system. I'm requesting that if I'm in the chamber, you have the same level of air circulation in that chamber or as close to it as you can, what I find when I'm on an airplane flying. I think that's the minimum the public should be expect. And Mr. Madsen's apparently on the panel, so I would be asking you to ask him whether that is actually the level of air circulation that will be available to keep us healthy if we are able to sometime be back in in-chamber meetings. So I believe that's a pertinent question. Thank you for the opportunity to speak today. And I, of course, will be the only public participant because nobody else has the ability or the persistence to get onto this meeting. Thank you for the opportunity to speak.
All right, thank you.
So Virginia, my hand's up and I'd like to say something if I could.
Yes, please.
So I just want to respond a little bit that I had a constituent that wasn't able to get on the meeting earlier. I texted her when we were on and she got right on. So I want to just say that I do think people are getting on. Maybe they don't want to say anything, Kent. So just that I just confirmed with her that she's on and listening. And so I just want to put that out there.
All right, well, thank you.
And that was through you. So there you go. Thank you.
All right. So if there's another person that is.
One more thing, I did not give her a passcode. She did it all on her own. All I said was we're up and running. So no, it wasn't through me.
Okay.
Didn't work for me.
Okay, so Michelle,
No.
do you know if the person, she doesn't want to speak? I can't.
No, she's fine. She's wanted to listen to the meeting and that's what she's doing.
Okay, all right, thank you. All right, so Tracy, are there any other hands up that you can see?
I do not see any hands. If you would like, I could take a roll vote.
If there's no other comments from board members or staff? I don't see any. Yes, please.
Okay. Supervisor Madrone? He said yes, but I didn't hear him say yes. There he is. Supervisor Bushnell?
Yes.
Supervisor Bass?
Yes.
And Supervisor Bohn?
Hey, sure.
Passes 4-0. Thank you.
All righty. So that looks like we are done with today's meeting. So we will adjourn until next Tuesday. And hopefully we will not have the technical difficulties for everybody. So have a good rest of your Friday.